So we are now on the oral route of drug administration and the first pass effect. So the oral route of drug administration is also known as the drug administration by mouth, per os, per orem, or PO. Orally administered drugs can be in the form of oral dosage forms. So these include tablets, boluses, powders, pellets, capsules, and pills, among others. And we also have the specialized delivery systems in the form of enteric-coated tablets and sustained action or controlled release preparations. So oral absorption occurs mostly in the duodenum, also occurs in the mouth, stomach, and the colon, depending on the species. Drugs that are administered orally are exposed by several barriers to absorption. So example of these barriers are the low pH. We also have the presence of digestive enzymes, intestinal microflora, and the ingesta that vary among species. So all of these factors can serve as a barrier for the absorption of orally administered drugs. So for the advantages and the disadvantages of the oral route. So the oral route is usually considered to be the safest, convenient, and economical route of drug administration. It may require the drug to be mixed in the food to facilitate administration, and the food may also stimulate the bile secretion from the liver, which will help dissolve lipophilic drugs to increase absorption. For the disadvantages of the orally administered drugs, so first, acidic environment of the stomach and the digestive enzymes may destroy the drug. And for ruminants, the presence of the bacterial enzymes may inactivate the drug. Also, some drugs may also irritate the GI mucosa. For some other disadvantages of the oral route, so the presence of food may adversely alter the drug absorption. Antimicrobials may also alter the digestive process in the ruminants. And some drugs are extensively metabolized before they will reach the systemic circulation, and this is known as the first pass effect. So what is this first pass effect? So before we are going to describe the first pass effect, let us first understand the hepatic portal circulation. So when drugs are absorbed from the GIT or from the gastrointestinal tract, it enters the portal circulation and passes through the liver before reaching the systemic circulation. So we have here a diagram of our hepatic portal circulation. So the portal system begins in the capillaries and venules of the digestive system. So the blood coming from the gastrointestinal organs, particularly the stomach, the pancreas, and the portions of the intestine, as well as the spleen, will be delivered via the hepatic portal vein towards the liver. So the liver will then process the substances from the blood and pass it into the general circulation. So we have here the hepatic veins and the inferior vena cava that will transport the venous blood towards the heart. So from the heart, the venous blood will be pumped towards the lungs for oxygenation. Oxygenated blood will go back to the heart, and the heart will pump it towards the aorta, and the aorta will lead into the abdominal aorta to the hepatic artery, and the oxygenated blood will go back to the liver. So the liver will receive the oxygenated blood from the hepatic artery. So consequently, the portal blood contains the substances that are absorbed by the digestive tract. So those blood coming from the digestive tract, particularly in the stomach, the large intestine, will be transported to our portal system towards the liver, and the liver will then process it, and it will go to the systemic circulation via the hepatic veins, to the heart, to the lungs, and to the systemic circulation, and going back to the liver. So what is this first pass effect? So a drug, after being absorbed in the gut and entered the hepatic portal vein circulation, will undergo a high degree of metabolic transformation in the liver before reaching the systemic circulation. So as we have earlier discussed in a hepatic portal circulation, before the blood coming from the stomach will enter the systemic circulation, it will first pass through the liver via the hepatic portal circulation. So it can significantly reduce the absorption of the active drug even when it is absorbed across the mucosa. So the drugs that are absorbed via the GIT are circulated to the liver first via the hepatic portal vein. The liver will then act as a filter. Only part of the drug is circulated systemically. So the combination of the processes is termed as the first pass effect. So we also have here a simplified diagram of our first pass effect or our first pass metabolism. So we have here our GIT, we have here our gut wall, we have here our portal vein, and the liver. So as you can see here, this diagram shows the pathway that an orally administered drug passes through before it reaches the systemic circulation or before it will be bioavailable in the body. So as you can see here, the swallowed drug will pass through the digestive system. And as you can see here in the digestive system, the drug will undergo metabolism. After absorption in the GIT, the blood now coming from the GIT will first pass to the portal vein towards the liver, and the liver will filter it. And in the liver, it will also undergo metabolism before it will be bioavailable, or before it reaches the systemic circulation. We also have here different drugs. We classify different drugs according to their extent of first pass metabolism. So some drugs are extensively metabolized by the GI mucosa and the liver before they reach the systemic circulation. So we have here those drugs having a low first pass metabolism. So example of this is the phenylbutazone. We also have those drugs that have an intermediate first pass metabolism. So example of this is aspirin. And we also have those drugs that have a higher first pass metabolism, such as the propanolol. Also, in here, we have testosterone. So testosterone and hydrocortisone, for example, have a higher first pass metabolism, so they are not recommended to be given orally. So what is the clinical significance of the first pass effect? So drugs with a high first pass effect have considerably higher oral dose than the sublingual or the parenteral dose. A drug that is administered through the oral route undergo high first pass metabolism. High first pass metabolism causes or results to a less bioavailability of the drug, and the sublingual route will escape the first pass metabolism. So when we say sublingual route, that is a pharmacological route of drug administration wherein the substances will diffuse into the blood through the tissues under the tongue. From the word sublingual, which is under the tongue, so the drug is administered under the tongue. So this is a good alternative for those drugs having a higher first pass effect. So they can be administered via the sublingual route to escape the first pass metabolism.